Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. Uttar Pradesh is among the top 5 states with the highest COVID-19 caseload in the country. So far, the state has recorded over 15,60,000 cases. And even though the new cases that it is reporting have started to come down a bit, the daily death count is still on the rise. On Wednesday alone, the state reported 329 deaths. And these, of course, are just the official numbers. The state's crematoriums and burial grounds, which have been working around the clock, tell a much grimmer story. And what is happening in the state right now is what is happening in so many other parts of the country as well. The virus, after wreaking havoc in cities, is now reaching smaller towns and villages. Now, Indian Express's Dipankar Ghose has been traveling across the state to many of these smaller towns and villages and has been reporting how they are crumbling under the second wave of the pandemic. So far, he has reported on Muzaffarnagar, Saharanpur, Kasganj, Aligarh and Rae Bareilly. And his reports reveal the chaos that the state finds itself in and how people have been left to fend for themselves. In this episode, we speak to Dipankar about what he found out during his reporting, starting with how the state's health infrastructure has been affected during this time.
So Uttar Pradesh's healthcare is clearly very strained because Uttar Pradesh is India's most populous state. And what that means is whether it is an urban center in Uttar Pradesh, whether it's Lucknow or smaller cities like Muzaffarnagar, there is a different set of issues with everybody from the villages and the towns rushing to particular district hospitals or private institutions. You have similar problems in terms of what you've seen in Delhi and in Bombay. I mean, lesser extent now, but picture the issues in Delhi of oxygen crisis, of people running around to try and put together cylinders, of hospital beds not being available, or government hospitals being very, very strained. So that is also the picture in one broad sense of UP cities. Now, unlike Delhi, UP also has a lot of villages. And these villages in district headquarters or in districts that don't have such big either private hospitals or district hospitals. So I think if you were trying to look for it in a word, it is that what COVID has done is that it's put a lens on the complete lack of any sort of professionalism or resources, both human and infrastructural, that UP has.
Now, to illustrate this, Dipankar first talks about Muzaffarnagar, which lies in the western part of UP. This is the part that has bigger towns and is considered to be wealthier than the eastern side.
Now, Muzaffarnagar actually has a medical college and it has 2 or 3 private hospitals as well, which are now treating this. But so let us say I have symptoms, but I haven't got a test. Now, testing by itself is a problem, even in these small towns. But let us say I've had no time, I've had nothing. Now, I will call an ambulance and let us hope the ambulance comes and let us hope it has oxygen. In most cases, it doesn't. But say it brings me to the first port of call is an isolation ward in either the district hospital or the medical college in Muzaffarnagar. So the district hospital's isolation ward that I saw was frankly ridiculous in the way it was operating. So there's a grill door in front and this boy gets out of the ambulance who is with his father and his mother still inside the ambulance van, and he walks straight into the isolation ward looking for a bed, shouting and screaming, desperate, of course, because the person that he loves is inside and is critical.
At this point, Dipankar says the man is sent out and told that there is no space in the hospital. The man then asks, what is he supposed to do? But there are no answers. Though the ambulance driver and the staff approach him and tell him that he should wait it out. They tell him that the hospital will work something out, but he needs to show them that he will stay, and so he shouldn't go away.
So as they shut the grill door, there is another entrance from the right. Now, they are so understaffed in terms of their nurses and ward boys and doctors that are available, is that inside an isolation ward, where the doctors are very aware that a majority of these are COVID patients, whether they have a test or not. They have breathing issues, they have fever, they have cough, they have all the classic symptoms of COVID. But what you find is, given that there is no infrastructure and given that there is no hospital staff, It's a complete free for all. There are attendants that are inside these isolation wards, which makes a mockery of the very word isolation. They're not there because they want to be. They're there because they believe that the doctors and the nurses are so overwhelmed that they will not be able to give their patient care. So you'll find a mother next to a son's bed giving him water, when that mother could therefore be the next COVID infected patient in that ward, and so on and so forth. So every bed you'll find people just going in and out. There is no sense of isolation. And there is no sense of isolation because the doctors off the record will tell you that we need hands. And it is not like if I had 10 doctors in here and 20 nurses and 30 ward boys, then I would be in a position where I could tell an attendant that, look, please stay away because we are in charge and we will take care of your patient. The doctors and nurses are actually quite grateful for the attendants to be inside because there's an extra set of hands. So when you issue an instruction that something needs to get done or somebody needs to go and run and get something, the nurses and ward boys simply aren't there to do it because there aren't enough. So the attendant will go and do it. The other level, of course, is that given the complete sense of apathy and complete sense of a system that has crumbled, doctors also don't want to get into arguments with angry, enraged attendants constantly. So if the option is that they are inside, it's an option they'll take and try and save the patient.
And he says that in that sense, this is a complete crumbling of the system. And there is now a spotlight on questions like, would we have been in this crisis if we had enough doctors and nurses and other healthcare workers?
Because make no mistake, some of those attendants that are going in, either they're already COVID positive and they're infecting other people in that ward, or they are infecting everybody else when they come out of that hospital. So I saw a son, his mother, weak mother, asking for biscuits. His mother is breathless, can't eat, but is asking for a packet of biscuits. So this son walks out of that isolation ward, steps out of the hospital, goes to the shop across the road, buys biscuits, and comes back in. Now, just the thought of the amount of people he would have infected in that period, if he is positive, which he's likely to be given he's in an isolation ward, is quite scary.
But this was the case in Muzaffarnagar, which, like mentioned earlier, is a big district. It has hospitals, government and private, that people can go to. But the situation is different in villages because they don't have such facilities.
So in that, then there are other issues. Given that the spread of COVID is now entering rural areas, or has actually been for a while, especially in Uttar Pradesh, you have even hole-in-the-wall doctors with dodgy degrees that are completely full up and treating patients on their own because the patients have nowhere else to go. Basically, there are signs of a healthcare infrastructure system that has completely crumbled under the weight of numbers, under the weight of years of a lack of institution building, under the weight of rumor and false information. And basically, people have been left to fend for themselves. And in rural India, particularly rural Uttar Pradesh, that can be very disturbing and very scary things.
Now, the hole in the wall places that Dipankar mentions here, he had come across one such place in a village in Saharanpur, run by a guy named Dr. VK Sharma, who, despite not having proper medical qualification, is now having to make life and death decisions. Dipankar tells us about him.
So, typically in a village, in a lot of villages across, when you drive around UP, when you'll find a village or a really small kasbah will have a particular marketplace. And in that marketplace, you'll nearly always have one doctor or two doctors' rooms. There will be a mechanic shop, there'll be a fruit seller, like with shutters, and then there'll be one doctor sitting there. Now, these doctors of course, they're not very well qualified. Dr. Sharma himself has GAMS degree, which is a graduate of Ayurvedic Medical Sciences, I think, from Lucknow. It's a course that has actually been discontinued in the 80s, but he's been practicing for a very long time. And he doesn't just do Ayurveda, that is his degree that he's put up there. He also practices allopathic medicine. Now, the thing is, there shouldn't be judgment here, simply because Dr. Sharma has been aiding or helping that village with its treatment in the absence of any other care for a very long time, for about 45 years. Now, the people that are coming to him, they are coming to him either as a port of first call, which is they come to him and say that, look, I'm getting breathless or have cough and fever, and he starts treating them then and there. Or if he's more serious, he sends them, he refers them away. Or, of course, they're coming after they've exhausted all other options and the district hospital they've not found space or they've not found space somewhere else.
Like he says, the place where Dr. Sharma works, just about 11 kilometers away from it, there is a community health center. But when Dipankar visited the center, it was completely deserted. And this place is ideally supposed to cater to as many as 80 villages. So clearly, this health center was not an option for people who come to Dr. Sharma. Plus, the nearest towns are 30 to 40 kilometers away. And even then, it's not like there's a guarantee that one will find a bed there.
So Dr. Sharma has been put in a position where he shouldn't be put. So for 40 years, what he's done is he has tended to patients with small, non-serious illnesses. If you've got a cough, if you've got a fever, if you've got something wrong with your stomach and it isn't COVID, Dr. Sharma is the person the village has always gone to. And he's the man they trust. So he has a particular credibility, but he is simply out of his depth now. It is a hole-in-the-wall clinic, and he is treating life and death issues. And I think what was important there was to say that even in a hole in the wall, there were 6 cots around him. 2, 3 of them had saline drips on. So there were very serious patients that should have been in hospital. But for whatever reason, either they got to Dr. Sharma so late that they could go nowhere else, or they roamed around all these hospitals and couldn't find any place and have come back to Dr. Sharma. And a small hole in the wall place is now making life and death decisions that they are simply not qualified for. So I think the larger question is about how UP is just reeling under a complete breakdown of its healthcare, which means that even small hole in the wall clinics like Dr. Sharma's is having to deal with cases such as this.
The problems that we are seeing in the state are, of course, a result of larger systemic problems, including the fact that India does not invest enough in healthcare. India approximately spends 1% of its GDP on public health, which is the lowest in the world. In fact, in the last session, India's healthcare budget was reduced by 9.5%. Moreover, it seems clear that the state government also did not prepare enough after the first wave. The crisis now seems like a result of both of these things.
I think both issues are very clear to see, and both of them exist. It is not one or the other. Of course, we have a problem with what we've done with healthcare over our period and how much importance we've given it, and how intrinsic it is to our politics, if at all. I mean, please remember, UP still had a panchayat polls on, even as this pandemic was raging, and health wasn't really something that was being talked about. So there is that. But there is also, I think, a very real sense that if not complete prevention, mitigation was very possible. And mitigation was possible to the extent that you would have controlled the damage a great deal.
In fact, when Dipankar spoke to politicians in the state, they told him off the record that the panchayat polls, which were conducted when the second wave was very much on the rise, they did see a huge gathering of people.
In fact, one politician's home that we went to, Kuwar Devendra Singh Yadav of the Samajwadi Party, people in his house were still kind of looking at or talking about the panchayat elections, because there is one stage left. After you elect the Zilla Panchayat and the block level representatives, they then have to elect one leader to head the block and head the Zilla Panchayat. So those conversations were still on. So there were a lot of things that happened in the here and now in the last 3-4 months that have also exacerbated this crisis. I don't think there's any questions about that. There are any doubts about that. Also, given that you're looking at, I mean, even in small town India, you are looking at people now, you can see fear. But I think people will also tell you, even 2 weeks ago, we were entirely normal. In rural India, there has never been a very strong sense of masking up or social distancing. I think the first wave kind of passed it by a little bit. Of course, there were enough cases, but there was also, therefore, that is a failure of political messaging, of telling people that this is what needs to happen right now. And are you really doing it? Are they really masking, looking at it, getting your political representatives to be as serious about masking up and social distancing as possible?
Plus, on top of this, Dipankar says that the state is also experiencing a humongous shortage of vaccines.
When we went to Saharanpur, neither the CHC, the PHC didn't have it. It was boarded up. They said, we haven't had it for 3 days. The CHC said, we don't have it either. There were people that were walking in asking for vaccinations, though very few. And the numbers kind of speak for themselves. The vaccinations are terribly slow. And, oxygen. In Muzaffarnagar, the first site that you see when you enter the town is there is this ITI center where private people waiting for oxygen cylinders. And so all of these crises, of course, could have been mitigated to a great extent.
And at this time when people, especially in small towns and villages, need the help of politicians, Dipankar says that no one can be seen on the ground. In one of his pieces, he had written about Kasganj, which is one of Uttar Pradesh's smallest and newest districts. There, he had tracked down multiple political representatives of different parties. And what he found out was the fact that there was a complete abdication of responsibilities from all of them. And the thing to note is that Kasganj is a district which has a BJP MP and a BJP MLA.
Now, the BJP MP is nowhere to be seen in Kasganj. His house is locked completely. We tried calling him twice. At least, even in that conversation, frankly, I introduced myself as a journalist from the Indian Express, and I still didn't get a call back. So can you imagine a poor person looking for help? And so that door was very firmly padlocked. One of the BJP MLAs from the area, his wife is ailing, so that's perhaps one reason. That's fine. The other BJP MLA says that there's no need to help. People are dealing with it themselves. He's not got any calls, despite the fact that Kasganj is a small place. It has rising cases. Apparently, he's just been, nobody's called him for any help, which is very strange because people in Kasganj have been going to Delhi, going to Lucknow for treatment because the deputy CMO tells us that their L2 hospital, it's not even a level 3 hospital, their L2 hospital doesn't work because they don't have an anesthetist or any specialists. And it's just their L1 hospital, which is basically oxygen and medicines, that works. So it's bizarre. It's an absolute, complete political abdication. Every single neta that you hear of here, not one of them was actually on the ground.
He says he met the Samajwadi representative at his house, he met the Congress representative at his house, and the Bahujan Samaj Party representative had just left to go to the neighboring district of Etah.
The BSP person just very frankly told me, I've taken off to Etah and I'm not coming back right now. So he's very blunt and said, I can't help. Nobody can help. We're all afraid. We're all dying as well. The BJP MLA I met at the BJP office after he had come just for that meeting. But otherwise, he was going around for the panchayat elections. And the BJP MP is simply not here. So, and the reason why this is very important is for our listeners who are in Delhi, who are in Bombay, the demographic. When you have seen governments or political systems collapse in urban centers, you have been able to turn to social media. And through social media, you have been able to turn to politicians, perhaps, to reach out to you. That is your medium of communication. In rural Uttar Pradesh, that medium, that privilege of Twitter, of Instagram, of Facebook doesn't exist. And if it does, it exists to very, very small few people in district headquarters. Otherwise, it doesn't. Which means that if I am from a rural village in Kasganj, the person that I go to for help will be the political hierarchy. I will go to my block representative, but he's busy in the elections. Then I go to my MLA, but my MLA doesn't seem to care. And then I'll go to other people, but just not there. So I think why that political representative is so important, particularly in rural India. He is crucial for help, and he is just not there. And that is also one of the reasons you are finding such a crisis. Not only because there is no help, but people don't know where to get it. People don't know where to call. I don't know if my local neighborhood shop does not have medication. I don't have the system A where I can put out a lead and ask for a lead on social media, and B where somebody will respond to it. That ecosystem, that network doesn't exist. So it has always been the political class. And that political class is failing today. And people are dying and suffering because of it.
He says that this has left people feeling helpless. They are frustrated and angry with the system, the administration.
Because now what has happened with COVID, with how it's taken over the narrative, not just narrative, but how it's taken over lives in villages. There is a very deep set fear of death. And I don't know how to explain this. I know this is something everybody is facing, even in the cities. But you are absolutely mortally terrified of the most basic things you have been feeling since you were a little child. You are terrified of a cough. You are terrified of a sneeze. You are absolutely terrified of your stomach grumbling. And that is exacerbated in India's villages in Uttar Pradesh by compare it to Delhi and Bombay, and you'll find that once the positivity goes down, in Delhi it is, and in Bombay it has, at least there is the security that you will probably find a bed, that you'll probably find healthcare. In UP, that doesn't exist. So that is a very difficult word to kind of zone in on. It's a combination of fear, of anger, of desperation, of resignation, even. It's a very exhausting place right now.
Now, the other thing that is not getting enough attention right now, because our healthcare systems are collapsing, is the fact that this crisis will also have severe economic ramifications. The money that people are losing trying to save themselves, their family members, or the daily wages they're not getting will affect them for a long time. And this will affect not just their financial security, but their nutrition levels, their children's education, and their mental health. So the decisions, say regarding lockdowns that the administration takes, has an effect on all of this.
UP, for instance, is in partial lockdown. What that means is there is essential shops are broadly open, certain industries can open. It's not as stringent as it was last year, but yeah, a lot of private institutions are all shut. And one of the things is that conversation of lives versus livelihood and that conversation of Jaan and Jahan is when we kind of saw this huge wave of cases that came and these deaths that were happening. I know that there is a lot of conversation of a national lockdown and a stringent lockdown, all of that. And I do not understand it. Of course, when people are dying, you must protect and you must do all of that. But what is key here is to understand that that is still not a simple answer. And it is not an option that is without consequence. Given particularly that what you're not seeing in these state lockdowns as opposed to last year is a relief web. Last year, please remember that when the lockdown did happen and those migrants, we saw those heart-rendering images of those migrants walking back and all of that was happening. Even in that dark time, there were NGOs, there were people that were helping, that were trying to give people ration. There were state governments that had given free ration to everyone. And apart from the formal systems, there were informal systems. People giving loans to each other, doing all of that, trying to help out. After 1 year of economic hardship, even those resources to help have now dried out.
Like when Dipankar went to Aligarh earlier this week, he found out that people who were standing and waiting at the labor chalk weren't getting any work. Though he was told by laborers that now only rich people come to there in their cars and take them to lift the bodies of their family members because they're too scared to touch the bodies because of corona.
And apart from that, there is absolutely no money. And what had sustained them for a year, even that much, that saving or that person who would help them out, even they've run dry. So that economy question is not just a larger macroeconomic question. It is also the question of lives on the ground. What will they do? What will they eat? And those are also important to answer. So if you're considering a lockdown, there are ramifications to that. And that ramification also needs to be considered. And again, you do need a huge relief web to kind of sustain for a particular period. And the economic cost is very, very high again. If you go around the cities of UP now, you will find a veneer of a little bit of normalcy, sabzi market, mein bheed hai, things like that. But your stores are shut, your money spinning institutions, whether it is, restaurants or anything else that kind of fuels the economy, even locally, those are all shut. So these are nuanced decisions to take, and there is no space for mistakes because lives are at risk. And there is no space for knee-jerk reactions as well. Everything has to be considered from also a very important lens of what is it going to do to our poorest. If you don't think about that, then you're going to have a problem.
You were listening to Three Things by The Indian Express. Today's show was written and produced by me, Shashank Bhargav, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcast@indianexpress.com.